Hi, my name is Jody. I'm the Director of Nursing of GTG Care. Today we're going to be demonstrating how to clean a G-tube. First, you want to prepare all the items. We have 2x2 split sponges, and we have some gauze, 2 different piles. We have one set we're going to wet, one set's going to be dry. Okay, so we have Miss Leone here. She has CP, and she's a GJ tube. As you can see, her tube is a little dirty today, so it's perfect. Now we're going to get a bottle of saline. You're going to wet the gauze. Okay. We're going to take one and we're going to wipe around the tube gently. Okay. I know it's cold. I'm sorry. I know. I know it's cold. I know. I'm sorry. Sometimes if there's a little bit of crustaceans there or anything stuck on the skin, you can wet it and let it sit. You want to do the next one. You want to clean it from inner to outer so you don't get anything inside the tube. You can lift it gently. You don't want to lift too much. Okay, Leon. Okay. All right. Then you want to pat it dry. You don't want to leave it wet. If it seems a little bit red and irritated, you can add triple antibiotic ointment. It's okay. It's all right. There you go. Okay. Almost done. Almost done. Okay. You want to make sure that it's really, really dry. You don't want to leave any extra moisture there. It will promote skin breakdown, make the tube a little bit more irritated. Okay, there we go. There we go. Now you want to open your 2x2. It's split already, so it makes it very convenient to place it underneath. You don't need to put tape on the edges. If it gets soiled, change it. This should be done at least once a day. More often if needed, if the tube is dirty or it's draining. Okay. There we go. Okay. There, Leone, all done. Okay. And then it should look nice and neat like this. And that's it. Pretty simple. All done, Leone. How bad was that? That wasn't bad at all, right? No, your tube's all clean. Feel better?
Hi, princess.
I know. You feel all better?